Role of head nurse in lean resource management. Lecture 2. Understanding nursing resource management. The art and science of managing resources for safety and quality. Outline. 1. Core concepts. 2. Role of the head nurse in resource management. 3. Challenges to nursing resource management. 4. Current state analysis tools. 5. The mandate for the modern head nurse for effective resource management. Learning objectives. By the end of this session, head nurses will be able to 1. Define nursing resource management and its core challenges. 2. Articulate the direct link between resource allocation and patient outcomes. 3. Identify the multifaceted role of the head nurse in resource stewardship. 4. Conduct a basic current state analysis of their unit's resource management. Head nurses are the operational engines of the healthcare system. They bridge the gap between administrative high-level policy and the reality of clinical patient care. Head nurses bridge the gap between managerial and clinical nursing. Head nurses time management. Head nurse is a multitasking job that requires proper time management. 1. Prioritizing and assigning staff for patient care. Clinical leadership. By identifying the top critical tasks of patient care and ordering them by priority. 2. Managing administrative work like delegation. Assign tasks based on staff skills and competencies to free up time for other activities. And management of resources. It is one of the most critical and often most challenging responsibilities. 3. Professional development and staff growth. Coaching and mentorship of staff members of her team. Nursing resource management. Definition. It is the systematic process of planning, allocating, and utilizing nursing resources that means people, time, supplies, and equipment to deliver safe, effective, and efficient patient care within a defined budget. It's the strategic management of all resources to meet patients' needs. 1. Managing human resources. Management of the nursing team, and the productive use of nursing hours. 2. Managing materials, supplies and equipment, ensuring availability and functionality of what is needed to do various patient care jobs. 3. Managing financial resources, budget, operating within the financial framework allocated by the administration. When these elements are well managed by the head nurse, her unit runs smoothly. When they are not, the challenges become immediately apparent. Role of head nurse in nursing resource management. In essence, the head nurse is a strategic manager of human and material resources, whose leadership and decision-making are vital for 1. Optimizing patient outcomes. 2. Ensuring staff satisfaction. And 3. Achieving organizational efficiency within a defined budget. 1. Managing human resources. Of all resources, nursing staff is the most critical resource. Head nurse duty as a human resources manager involves managing the right number of staff and the right mix of nursing skills, and ensure they are in the right place at the right time. Key management activities. 1. Staffing and workforce management and planning. 2. Management of nursing time and scheduling. 3. Staff empowerment and delegation. 4. Staff performance management. 5. Endorsement of staff motivation and retention strategies. 6. Leadership and team building. 7. Promote interprofessional collaboration. 8. Problem solving and decision making. 1. proper staffing and workforce management and planning. Effective workforce management and planning prevents understaffing, burnout, and patient safety risks. The head nurse has to 1. Manage nursing staff resources according to patients' needs. 2. Align staffing with both patients' number and acuity while complying with organizational goals. 3. Assess evidence-based patient census and acuity levels. 4. Perform data-driven forecasting of new staffing recruitment needs, short-term and long-term. Nursing staff resource allocation and its impact on patient outcomes. The allocation of nursing resources directly and significantly impacts patient outcomes, safety, and the overall quality of care. Numerous studies consistently demonstrate a strong correlation between adequate nurse staffing levels and improved patient safety indicators, while inadequate staffing is linked to adverse events. Recent research indicates that optimal nurse-to-patient ratios vary by unit but generally suggest higher nurse-to-patient ratios, that means fewer patients per nurse, for better outcomes, with common recommendations including 1 nurse to 4 patients ratio for medical and surgical units, and 1 nurse to 1 patient ratio, or 1 nurse to 2 patients ratio for intensive care units, ICUs. Studies show that higher nurse-to-patient ratios, that means fewer patients per nurse, lead to improved patient safety, reduced mortality, and better patient satisfaction. Optimal nurse-to-patient ratio according to health unit. Intensive or critical care units, ICU. Optimal or recommended nurse-to-patient ratio is 1:1 or 1:2. According to severity of cases. Trauma patients units, ER. Optimal or recommended nurse-to-patient ratio is 1:1. General emergency department and medical or surgical units. Optimal or recommended nurse-to-patient ratio is 1:4. Key impacts of inadequate nurse-to-patient ratio. 1. Patient mortality. Higher registered nurse staffing levels are consistently associated with reduced patient mortality rates. 2. Adverse events demonstrate a notable increase with insufficient nursing resources. This includes 1. A higher incidence of medication errors, as overworked nurses are more prone to mistakes in drug administration. 2. Patient falls also become more frequent due to inadequate supervision and assistance. 3. Hospital-acquired infections, HAIs, can rise as reduced nursing capacity compromises infection control practices. 4. Pressure ulcers may increase due to less frequent repositioning and skin assessments. 5. Poor discharge planning and insufficient patient education, often due to time constraints, contribute to higher readmission rates. 3. Misnursing care is a direct consequence of heavy nursing workloads and inadequate staffing. This can negatively impact critical tasks such as patient ambulation, health education, emotional support, and timely documentation, all of which negatively affect patient recovery and overall well-being. 4. Patient experience is also significantly influenced by resource allocation. Patients in adequately staffed units consistently report better communication, more timely care, and a greater sense of safety and comfort, contributing to higher satisfaction levels. 5. Quality of care overall is compromised when nursing resources are stretched thin, leading to less thorough assessments, delayed interventions, and inadequate response to patients' needs. Think about a nurse who is responsible for too many patients. She is rushed. She may not have time for thorough hand hygiene, double-check a medication, or help a patient to the bathroom promptly. These are not failures of the individual nurse. They are failures of the system. The resource allocation system. The data is clear. When we get staffing right, we save lives and prevent harm. When we get it wrong, we put both patients and staff at risk. Optimizing nursing resource allocation is therefore not merely an operational concern but a fundamental imperative for ensuring patient safety, improving health outcomes, and maintaining high standards of care. It requires a strategic approach that considers patient acuity, nurse skill mix, and the overall care environment to achieve the best possible results for patients. The positive impact of optimal nursing resource allocation. Optimal nursing resource allocation have significant positive outcomes for both patients, nursing staff and the health facility. 1. Improved patient outcomes. Higher nurse-to-patient ratios, that means fewer patients per nurse, are consistently linked to reduced mortality rates, decreased rates of hospital-acquired infections, and shorter hospital stays. 2. Enhanced nurse environment and retention. Appropriate staffing levels and support for nurses will alleviate nurse fatigue, burnout, and moral injury, reduce job dissatisfaction and turnover, and allow time for professional development and mentorship. 3. Cost effectiveness. While initial staffing costs may be higher, the reduction in adverse events, for example, falls and infections, and reduction in readmissions leads to significant cost savings in the long term. 2. Scheduling or staff time management. Staff scheduling optimization is a primary responsibility, where head nurses ensure appropriate nurse staffing levels and skill mix within their units. This activity include develop and manage the shift schedule and assignments to ensure appropriate coverage, productive use of nursing hours, managing overtime, minimizing interruptions, make dynamic daily assignments based on staff qualifications and experience, skill mix, and patient acuity, complexity of care. Optimize nursing resource deployment to meet patient care demands while adhering to budgetary constraints and promoting staff well-being. 3. Staff empowerment and delegation. A head nurse, the unit manager and staff leader, holds ultimate accountability for staff empowerment through effective unit-level delegation. She has to ensure tasks are delegated and assigned based on staff competency. Core nursing delegation responsibilities of the head nurse. 1. Applying the 5 rights of delegation, ensuring the right task, right circumstance, right person, right direction or communication, and right supervision. 2. Assessment and assignment. Matching delegated assignments with the skills, experience, and competencies of nurses and support staff. 3. Supervision and accountability. Overseeing delegated tasks to ensure quality care, while maintaining responsibility for the final outcome. 4. Resource management. Allocating the required resources to empower staff and encourage them to perform their assigned tasks efficiently. 5. Policy compliance. Ensuring all delegation practices adhere to state laws and institutional policies. 6. Communication and support. Providing clear, concise, and written directions, and offering support to staff to facilitate smooth workflow. 7. Evaluation and feedback. Monitoring staff performance, evaluating patient outcomes, and providing constructive feedback. 4. Staff performance management. Role of head nurse as a staff performance manager. 1. Monitor the performance of nursing staff and the effectiveness of resource utilization. 2. Ensure that nursing practices align with established standards and best practices. 3. Ensure staff have the necessary tools and training to competently perform their job. 4. Identify areas for improvement and implement quality initiatives. 5. Endorsement of staff motivation and retention strategies. As staff manager, head nurse has to motivate staff and promote staff retention through 1. Provide immediate positive feedback and praise staff to enhance morale and retention. 2. Model expected professional behavior and ethical practice. 3. Mentoring staff to enhance their skills and efficiency in resource use. 6. Leadership and team building. 1. Act as a coordinator and negotiator to prevent and resolve interdisciplinary conflicts, for example, with physicians or other departments. 2. Create a supportive working environment that fosters the psychological safety of our team members. 3. Empower their teams and promote a culture of accountability. 4. Enhance the overall capacity and effectiveness of nursing resources. 7. Interprofessional collaboration. Head nurses advocate for their unit's resource needs and contribute to interdisciplinary collaboration and problem solving. Collaboration with other healthcare professionals, departments, and administrative leadership ensures seamless coordination of care, effective resource sharing, and alignment with broader organizational objectives. 8. Problem solving and decision making. Faced with operational challenges such as unexpected staffing shortages or equipment issues, head nurses are crucial in making timely and informed decisions to solve problems, mitigate risks, and maintain continuity of care. 2. Managing supplies and equipment. Inventory management. Definition. Inventory management is the process of ensuring that the right products and supplies are available at the right time in the right quantities to meet shifting customer demand. It involves tracking and optimizing the flow of medical and other supplies, including drugs, surgical instruments, medical equipment, masks, and patient care items, for example, intravenous infusion pumps, wound care kits, ECG devices. Goal is to achieve logistic efficiency, ensure adequate supply and proper maintenance while minimizing waste and cost. Role of head nurse as logistics and inventory manager. 1. Budgeting for new equipment. Supervise the acquisition of medical supplies and equipment, ensuring everything needed for patient care is available. 2. Monitoring cost-effective use of supplies. Identify and implement process improvements, for example, quality improvement initiatives that reduce waste and increase efficiency. 3. Making informed decisions to ensure cost-effectiveness without compromising patient care quality. 4. Monitoring and reducing waste, for example, expired supplies, inefficient processes. 3. Managing budget and financial resources. Operating within the financial framework dedicated for the health unit. Definition. Management of the unit budget allocated for personnel, supplies, and capital expenditures. Goal. Provide excellent care within budget boundaries, demonstrating value-added expenditure. Key budget management activities. 1. Budget development. Develop the unit's manpower, material, and equipment budgets. 2. Tracking labor costs, staff overtime costs. 3. Cost-benefit analysis for new technology or staff. 4. Monitor and ensure the cost-effective and appropriate use of supplies and equipment by subordinates. Challenges to nursing resource management. Nursing resource management faces numerous challenges in today's dynamic healthcare environment. Addressing these challenges requires innovative strategies, strong leadership, and a commitment to optimizing nursing resources for the benefit of both patients and healthcare providers. The storm of challenges. Head nurses live some or all of these stormy challenges in everyday practice. 1. Increasing the workload, with sudden rise of patients' acuity or number. 2. Budget limitations, which do not cope with the increasing demands of patients. 3. Inappropriate skill mix, too many new graduates and not enough experienced nurses. Such perfect storms are the everyday reality, and effective resource management is the navigational chart for safe sailing. Challenges to nursing resource management. 1. Inadequate staffing and nursing shortage. A shortage of nurses due to the escalating demand for healthcare services from an aging global demographics, and the inherently demanding nature of the nursing profession. 2. Intensified workload and burnout of nursing staff. High patient acuity, complex care needs, and administrative burdens all coupled with nursing shortage and insufficient staffing contribute to demanding workloads. Such factors lead to heightened stress, fatigue, nurse burnout, decreased job satisfaction, and high turnover rates. This not only impacts the well-being of nurses but also contributes to missed nursing care and compromises patient safety. 3. Resource-task imbalance, where nurses frequently experience a disparity between available resources, such as staff, equipment, and time, and the tasks required. This imbalance can lead to assignments without adequate preparation, diverting attention from essential duties, and unmet patient and family expectations. 4. Budgetary constraints, as healthcare organizations often operate under tight financial limitations, making it challenging to allocate sufficient resources for optimal staffing, technology, and professional development. 5. Technological integration presents a dual challenge. While technologies like electronic medical records, EMRs, can enhance efficiency and consequently improve patient care, yet, new technology often requires extensive training and can initially add to nurses' workloads if not managed effectively. Implementation and ongoing use of technology can also create new demands on nursing time and necessitate continuous training if not managed effectively. 6. Impact of the workplace environment. Issues such as inadequate supportive workplace violence or bullying, a lack of professional advancement opportunities, and exposure to infectious diseases significantly influence nurses' decisions to remain in or leave their positions, and negatively impact nurse retention. Cultivating a supportive and healthy work environment is therefore paramount for retaining experienced nurses. 7. Increasing patient acuity and complexity demand a highly skilled and adaptable nursing workforce, which in turn creates ongoing challenges for effective staffing and skill mix planning. Current state analysis tools. Identifying main points of nursing resource management. Before a head nurse can improve her unit's resource management, she needs a clear picture of current reality. This is what we call a current state analysis. It's like a diagnostic test for her unit. Definition: a structured method to understand exactly how resources are currently being used on your unit. Goal: identify gaps, inefficiencies, and opportunities for improvement. You can't fix what you don't understand. Key indicators for a head nurse to monitor on her unit. Indicator 1. Staffing effectiveness. Data to review. 1. patient classification or patient acuity data, real-time tracking of patient needs versus assigned staff. Is our skill mix correct for our patient population? 2. Staff working hours and work overload, overtime hours, and staff-to-patient ratios. Action. If acuity is consistently high, and staff work overload is rising, this is a documented evidence to justify an increase in core staffing budget. Indicator 2. Quality and safety. Data to review. Adverse events, like medication errors, fall rates, hospital-acquired pressure ulcers, HAPUs, and hospital-acquired infections, HAIs. Action. High adverse events accidents is a direct link to low staffing. Use this data to target specific process changes or reevaluate assignment methods. Indicator 3. Workforce well-being. Data to review. 1. Job satisfaction and turnover rate. For example, unit satisfaction surveys, exit interview data. 2. Burnout and fatigue. Tracking staff requests for time off. Review of reports of fatigue and exhaustion from staff clinic and system. Action. Implement flexible scheduling options. Ensure new hires receive proper orientation. And advocate for wellness support programs. Indicator 4. Supplies and equipment utilization. Data to review. 1. Supply waste audits. Tracking usage of high-cost supplies. 2. Supply use reports. Utilize supplies use rate indicators such as review of periodic automatic replacement, PAR levels. 3. Equipment downtime. Time taken for equipment, for example, monitors, pumps, to be out of service. 4. Do we have what we need when we need it? Action. Institute better training on equipment use to prevent damage, and develop a system for staff to quickly report maintenance needs. Indicator 5. Time and productivity. Data to review. Where are my nurses spending their time? How much is spent on non-value-added tasks? For example, searching for a doctor, hunting for supplies, or fixing errors. Action. Implement lean methodologies by optimizing ward layouts, improving inventory management through point-of-use (POU) systems. That means materials and inventory are organized and placed within easy reach. This approach minimizes wasted motion and reduces the time of searching for required items. Directly supporting just-in-time JIT usage of supplies or medications, and standardizing processes. Other actions include delegating non-nursing tasks to support staff, using technology like electronic health records, EHRs, to reduce documentation time, and providing staff with time management training. Indicator 6. Process and flow. Data to review. Are our admission, discharge, or transfer processes efficient? Where are the bottlenecks? Action. Do process mapping and patient flow data, for example length of stay and discharge delays. The mandate for the modern head nurse for effective resource management. 1. Be data-driven. Utilize patient classification and acuity systems to objectively demonstrate the true need for staff, moving away from just-in-time staffing models. 2. Champion your staff. Recognize that your human resources are the key to patient outcomes. Prioritize a supportive work environment, which is the best retention strategy. 3. Innovate with technology. Leverage electronic health records, EHRs, and other technologies to increase nursing efficiency and communication. 4. Adequate balance between resource utilization and patient outcome. Clearly and consistently consider the link between resource scarcity, for example staffing, supplies, and negative patient outcomes, for example errors, mortality. The management of resources must be viewed not just as a cost, but as an investment in patient safety and quality. To wrap up, nursing resource management is a strategic function integral to patient safety and staff well-being. Head nurse's role has evolved into that of a strategic planner, financial steward, and supportive leader. The path to improvement begins with a clear-eyed earned state analysis. Head nurse has the power, and the responsibility, to create an environment where her nursing team can practice at their best, and patients in her unit receive the safe, high-quality care they deserve. She can use the diagnostic toolkit and review the findings with her team and lead the improvement. Thank you.